In the eye clinic, we use a specific diagnostic test that reveals a widespread nutritional gap across the modern population. Most patients who undergo this exam walk away with a failing grade. This is the MPOD test. A low score here acts as a primary predictor for age-related macular degeneration, signaling a high risk for the kind of long-term vision loss that many assume is just an unavoidable part of aging. The MPOD focuses on the structural integrity of the retina's internal defense system, moving past basic visual acuity metrics like reading letters on a wall. MPOD stands for macular pigment optical density. It calculates the physical thickness of a specific biological pigment inside the eye, a pigment that clinical testing shows is severely depleted in the majority of people. A failing score indicates that the retina is operating without its physical armor, leaving the eye's most sensitive tissues vulnerable to irreversible daily damage. Rebuilding that protection requires looking at the microscopic anatomy of the eye. Tucked at the very back of the retina is a tiny, highly specialized region called the macula. The macula functions as the visual bullseye, the exact epicenter for high-resolution tasks like reading, recognizing faces, and distinguishing colors. To protect this region, the body deposits lutein and zeaxanthin to build a dense yellow-orange cellular matrix, acting as a physical wall. Humans have access to over 600 naturally occurring carotenoids, yet the eye specifically selects only these few pigments to form this barrier. This biological preference is so intense that the body concentrates lutein in the macula at levels over 1,000 times higher than what is found in the bloodstream, highlighting its necessity for visual survival. Lutein's distinct yellow-orange hue makes it an ideal physical barrier. As high-energy blue light strikes the molecular lattice, the pigment absorbs the energy. By dispersing it, lutein prevents light from damaging the delicate visual receptors behind the shield. Beyond light filtration, lutein also works to aggressively neutralize oxidative stress inside the eye. This chemical neutralization helps prevent long-term structural decay, specifically the formation of cataracts. Higher MPOD scores translate to immediate improvements in daily life. Patients with a dense pigment layer report sharper contrast, less disability from glare, and a faster recovery time after being exposed to bright flashes of light. A robust lutein shield actively upgrades your visual performance and comfort within the high-light environments of the modern world. Since most of us are currently failing the MPOD test, we need a specific protocol to reverse the depletion and rebuild the shield. Standard advice usually focuses on a diet rich in dark leafy greens. While this supports general health, it often fails to fix the specific deficiency in the eye. Scientific research shows that making dietary changes alone typically fails to significantly increase the density of the macular pigment. Meta-analysis data quantifies this disconnect, showing that a strict diet only yields a clinically insignificant 5 mg increase in lutein levels. Vegetable-rich diet remains necessary for the rest of your body, but it lacks the mathematical scale required to restore the eye's highly concentrated armor. Targeted lutein supplementation provides the only clinically proven path to reversing an MPOD deficit. The protocol for success requires an intake of 10 to 20 milligrams of lutein daily, maintained over a period of 3 to 6 months. This supplementary approach drives a 30% increase in MPOD density, successfully thickening the protective layer at the back of the eye. To optimize your vision, pair whole foods for systemic health with targeted supplements to build your macular defenses. Maintaining the eye's biological shield allows you to treat age-related visual decline as a factor you can measure and actively influence.